There has been a lot of discourse online about people who are too self aware for therapy. And I have some thoughts on this as someone who has been a practicing clinician for many years now and have never had a client that's been too self aware or too intelligent. For therapy. Hi, my name is Dr. Natalie Jones. I'm a licensed therapist. And there are people online that are talking about, I'm too self aware. My therapist told me I'm too self aware, or therapy wasn't really helpful because I knew too much and there was nothing that the therapist could tell me. There's been schools of thought that kind of go along, with either of those two trains, is usually what I'm finding from listening to some of the dialogue and discourse. And I've honestly, as a therapist, I've never had that happen where a client has come in and been like, I'm too intelligent for you, Dr. Jones, or where there's just been like a lot of downtime or dull, where the conversation is too dull, or there's just like a lull in therapy. So I think, there's a couple of things that I think could be going on based on the what I'm hearing in terms of the discourse. Um, One where people are saying, well, their therapist is telling them that. Um, their therapist is telling them, oh, you're just too self aware. You don't really need it. What may be happening is, um, what may be happening, or what my thinking is, or what I'm wondering about, is if you maybe have gone to see someone where what your needs and your therapist are not aligned, meaning that you've gone to someone who cannot help you because you're not aligned. And this can sometimes happen when you've gone to see someone who is a generalist or doesn't really have expertise and what you're coming with, the challenges or the issues that you're coming to them with. They don't necessarily have that experience, or maybe sometimes you can have a therapist that's just not interested in providing therapy anymore. And they are taking on clients because they need the money, but they're not really interested, or they're really not invested in doing therapy and helping you do the work, or they never properly learned effective techniques. That can also sometimes happen too, no matter how long someone's been in this business. So you can have a therapist that's checked out, or you can have a therapist that can't really help you or speak to this issue, or that's going through their own stuff, but they haven't said it. Maybe because they are collecting the money. So that could also be a possibility too. For people that say, so those are just some of my thoughts and some of the things I've actually seen over the years where there, there isn't a progression in therapy. The therapist is checked out, and when there's not a progression, or when you as a therapist, you're no longer interested in doing therapy, you should be either referring out, or B, getting consultation to see what your challenges are, or why people are stuck, or even consulting, on client cases, right? If you feel stuck, or if you are taking on someone that you're not necessarily sure about the issues, but you definitely have the desire to help. But intellectualizing is a defense mechanism. And I'm not saying that there's anything wrong with being intelligent, or even being an intellectual per se. But when you have it in a space where you're supposed to be vulnerable, it is a defense mechanism. And think about Freud 101. I've had people that I've worked with over the years, super intelligent people, And sometimes what they will do is they will give me the intellectual aspect of a challenge that they're facing, or they will intellectualize. I've even done it myself, and unconscious. So it's not always something that's conscious, and it's not always something that people know that they're doing. But as a therapist, you have to educate people on a defense mechanism, or do you realize you're doing X when you're talking about why? And so it's good to be able to call that behavior out and help them lay that out on a table and understand what's happening and why, and what feelings they're actually feeling, if that makes sense, or what's actually happening when you're talking about a specific person or situation, if that makes sense. Now, when you have people that say that they are too self aware and that they are too woke and that they don't need it, I've had people that do that as well. Excuse me, I've heard people that do that. Heard I've had some thoughts about people who do that as well. I can't talk. And so what tends to happen when I hear people say that is that it almost comes across as like I'm too good or I'm too smart to do the work. And so what I have experienced in clients who do this is clients who try to play games in therapy. Let me see what I can do or how I can get around doing the work. And let me see if Dr. Jones can catch up. It's almost like a game of chess, right? And this is something that happens a lot with personality disordered folks that I've worked with in before, or folks with personality disorders is what I should say. And I'm not saying that everybody who does that it has a personality disorder, but sometimes what people will do, especially if they're like mandated or like a partner has told them that they need to go, or they have an idea, they've been told a number of times that they most likely have a personality disorder. They'll come to therapy and see it, and sometimes they'll lie, right? And that happens too. And it's our job to call them out on not being honest or not being uh just not being forthcoming with what they're doing, or trying to um make what they're doing sound better, right? And again, it's still a defense mechanism, but it can also be a tool of manipulation as well, where it's like, oh, I'm too good, I don't really need it, or this. So sometimes people are deliberately doing things to see if you can try to figure out what they're doing, and if you could see what they're hiding or being deceptive about, or what they are having some resistance around doing the work on. And so there can always be some work done. Even with people that are well adjusted, very intelligent, and things like that. But as a therapist, I've never told a client that they're too self aware and that they don't need it. So that to me strikes as a red flag. I have been honest when I say, oh, well, we've reached the maximum benefit, as far as what your treatment issue is, and we can collaborate on what treatment issues are. But that it's concerning when people say they're too woke for it or they don't need it. That also may be a way to try to escape doing the work. Just some thoughts. There's always exceptions. There can be exceptions to the rule, but that's just an interesting conversation that I've personally have never encountered in client work, in working in all the many places that I have worked. So I hope that helps. Let me know what your thoughts are. Like, comment, share, and follow. Definitely give this a hype if you're on YouTube. Thanks so much.